Bismillahirrahmanirrahim. Assalamu alaikum. Dear audience, today my topic of discussion is about the use of contact lenses, their proper cleaning, and if it is not done properly, what are the possible complications and their management. Contact lenses are basically used for cosmetic purposes and for medical purposes. These are very safe to use provided the care and cleaning is done regularly. We use these contact lenses in our medical profession. When the patient comes, sometimes the corneal ulcer is not healing, we use and we call it bandage contact lenses. We use it in the management of keratoconus. We call it hard contact lenses, and this is a very effective way to treat keratoconus conical corneas. We also use these contact lenses when there is high refractive errors and patients use it, and these are very safe. Apart from this, these are also used for cosmetic purposes. They come in different shades and colors, and there is no problem with their use. But sometimes when proper care is not done, when proper cleaning is not done, then sometimes problems come which can worsen with the passage of time. So today we will discuss how to first of all clean these contact lenses, which are very safe to be used otherwise. The most important step in the cleaning of contact lenses is that the wearer should always wash his hands with soap properly. And after that, he should use a lint-free towel. Reason is that even the microfibers should not come on your hands. You can use any reliable cleaning system, but the main thing in all cleaning systems is rinse and rub technique. You have to take these contact lenses, you have to put it after washing your hands and drying it, you have to put on your hand these contact lenses and rinse it with your fingers gently so that they do not get damaged. This rinsing and rubbing gently with that cleaning system, whatever you are using, a reliable one, it will remove all the debris, proteins, dirt from your contact lenses. And after that, rubbing in your palm with your fingers gently, you can put these contact lenses in a clean container which comes with the cleaning system, and you can put that cleaning material, whatever you are using, for a while until it is properly clean. Then you take it out, cat it, throw the solution in the container. That solution should not be reused again. Every time you have to use new solution because it is contaminated. And after that, once the eye contact lenses are clean, dry, proper time has been given, proper instructions have been followed, you can use it. Make sure, please, that it should not be very old contact lens. It should not be small or bigger size, and there should be no broken edges, because the eye contact lens is coming in close contact with your cornea, and cornea is a very sensitive location. I have seen people during my career that whenever we ask them to remove the contact lenses for eye examination, without washing their hands and without properly following the instructions, they just remove it and put it on tissue paper and then putting again. And I have seen people developing complications and infections in the eye due to the contact lenses if they are not properly cleaned, if the instructions are not properly followed. Otherwise, as I earlier mentioned, they are absolutely safe to be used. So now we will see different examples, what happened in these patients when they did not follow the instructions and how it damages the eyes. This is a patient who developed eye infection. Here you can see all the whitening over there. This is a very advanced stage of eye infection. Inferiorly, you can see there is pus inside the eye, which we call hypopyon, and there is a big corneal abscess, and this abscess is almost covering the whole of the eye. A small rim of the cornea is left over there. Usually these infections remain anteriorly because of certain anatomical structures which are preventing its growth inside the eye. But they can penetrate, go deep into the eye, and once it goes inside the eye, near the retina, into the vitreous jelly, the whole eye is involved, and we call it endophthalmitis. And what to think about endophthalmitis? Even this corneal infection is vision-threatening complication. So this is a patient who did not take good care, who developed infection, who ignored it for a while and presented to the physician very late when this has happened. This is further course of treatment, that antibiotic eye drops were started. All the proper care was done, and now you can see that the central corneal abscess is regressing, decreasing in the size, but still there is hypopyon, that inferiorly you can see the pus over there is still there, and the conjunctival and ciliary congestion is still over there, eyes red, inflamed. So this is the further course of treatment and how it behaves after the treatment. This photograph, you can see the margins of this abscess are fading out. The infection is getting controlled because of the effectiveness of the treatment, and the photographer has made a thin beam of the cornea, slit light. Here you can see that there is pus in an anterior chamber, the portion behind the eye cornea, and he has beautifully shown the regressing and the decrease in the size of the corneal abscess. You can see that infection is now under control, getting under control. There is no pus, almost settled down. Inferiorly, you cannot see that white area, but still centrally there is corneal abscess which developed because of corneal ulcer. And we can say that things are going in right direction. The infection is getting controlled over there, and we have at least succeeded in controlling to some extent the infection. As I always mention, our first target is always to protect and prevent the loss of eyeball. Once we succeed in this, our objective, after this, of course, we will think about the vision, but our primary target is always to protect the eyeball. It should not be lost. Whenever a patient comes to us in our emergency, we examine the patient, we take visual acuity, how much vision is there, and after proper documentation, how much is the size of the abscess, as I mentioned earlier, how much is the height of the pus in the anterior chamber. abscess, a corneal ulcer, its size, location, everything we do it. We go for the culture and sensitivity, scrapping. We have to remove some material from this infected tissue in the eye, and we have to send it to the laboratory to know what organism is over there and what medicine will be beneficial in this treatment. We always use Gram staining and Gimsa staining, these two slides, and this is the culture medium. You can see this is its name is because of its color, chocolate agar we call it. Some bacteria are good to grow in specific culture media. They are put over there, given some time to grow, so that our pathology colleagues from laboratory, they can tell us properly what is the organism and which antibiotic should be used to control this microorganism. So this is one I'm showing, is the chocolate agar. These are two more. One is called thioglycolate and the other is blood agar. Also used some specimen also taken from the eyeball, from the cornea, is put over there and given time to grow under certain favorable and suitable conditions in the laboratory. These are blood agar and thioglycolate. Seborods, sometimes we are thinking about any fungus that may be over there. So seborods, and also we have got another culture medium, McConkey. So basically 5 these are mandatory which we use, and other we can also request depending upon the situation. Now this is very important. Why? When we do scrapping, when we remove some tissue from the eye gently, in fact we are decreasing the burden on the eye. We are also removing mechanically the microorganisms from the eye. And once these things have been sent, we can start our own treatment until we get the report. That is any quinolone broad spectrum antibiotics, eye drops, or sometimes we prepare the combination of in our pharmacy, vancomycin or ceftazidime prepared, we call fortified eye drops. We have to use it. We also dilate the pupil with cycloplegics so that the inflammation is settled down inside the eye, blood aqueous barrier. These are technical things which get settled down over there, and regularly follow daily these patients, documentation, everything is done. And in the meanwhile, we also do ultrasound to see that the infection has not gone into the eye. So this was briefly about the management. But the story started when we did not take good care of our contact lenses. We ignored the instructions and took the things casually. A small breach, a small scratch in the cornea, the front layer of the eyeball, is sufficient for microorganisms which are already present in our eyelashes to penetrate and go deep into the eye. These are some advanced stages. The reason I am showing you that I have seen patients developing blindness in both of their eyes because of carelessness in their young age. And in spite of this treatment, as I mentioned, we are giving antibiotics. We have to put these eye drops sometimes 1 hourly, alternatively. So there is regularly going over their antibiotics to control these microorganisms. And in spite of our treatment, in spite of our success, we get a scar. An eye is a medium through which the light has to pass. And once you develop a scar, it depends how deep it is, what is the location, is it central or it is in the periphery. It is going to affect your vision. It is going to stay. You have to live with that scar. It is very deep. So this was my today's presentation to stress upon the importance of properly cleaning the contact lenses. It is your choice. You can use it for cosmetics. You can use for as a replacement for your glasses as per the instructions of your optometrist. The doctors of optometry, they prescribe it. But my message is only to be vigilant, to follow the instructions of the cleaning system. And the one thing, as I mentioned, is rinse and rub technique to break the bacteria over there, and regularly clean the solution in the containers. Do not use the old solutions again and again. These things will help you to prevent any infection in the eyeball and ultimately having a better eye health. I want to thank my respected audience for their attendance and attention. Thank you.